Mackenzie Nicole Sidwell, and the topic that I have chosen for Bio 318 History of Medicine's final project is Human Immunodeficiency Virus Acquired Immunodeficiency Syndrome, which is known as HIV/AIDS. What is HIV/AIDS? Human immunodeficiency virus is a virus that attacks the body's immune system. White blood cells are the body's protection against infection, and HIV invades a certain type of white blood cell, which is CD4 positive T cell, and then it damages it, and then the virus makes copies of itself and spreads throughout the body, infecting more and more T cells. And then over time, healthy T cells go into decline while HIV-infected cells increase. And this weakens the immune system and then leads to AIDS. AIDS is acquired immunodeficiency syndrome and is a condition that is chronic and potentially life-threatening caused by untreated HIV. How has this disease been understood? Well, HIV/AIDS interferes with the body's ability to fight infections. And HIV/AIDS in humans come from a chimpanzee in Central Africa, and over time it spread throughout the entire world by infecting more and more people. What have people thought caused the disease? In the early 1980s, people thought this disease was caused solely by unprotected sexual activities between men, when it was discovered that over 20 men had contracted the same symptoms after sexual activity and was shortly diagnosed with HIV/AIDS. It was changed over time when people of all types were contracting the disease. Now HIV/AIDS is known to be caused by the transmission of the virus through infected blood and bodily fluids by spreading it through blood products, including unclean needles or unscreened blood, having unprotected oral, vaginal, or anal sex, and or mother to baby by pregnancy, labor, or nursing. Has there been any change in the way that this disease has been defined? There has been a change in the way the disease has been defined. At first, when nobody was aware of the disease, many healthy gay men were diagnosed with Kaposi sarcoma and pneumocystis pneumonia. And then HIV/AIDS was defined after several years of research. And there are different stages to HIV/AIDS. Stage 1 is acute HIV infection. Stage 2 is chronic HIV infection. And stage 3 is acquired immunodeficiency syndrome, or AIDS. Have different symptoms been attributed to this disease? There are different symptoms and severities to each stage of HIV/AIDS. The primary infection, or stage 1, acute HIV infection, can include the symptoms of fever, headache, muscle aches, and joint pain, rash, sore throat, and painful sores, swollen lymph glands, mainly on the neck, diarrhea, weight loss, cough, and night sweats. The clinical latent infection, chronic HIV infection, stage 2, is often asymptomatic and can last for years if the patient is not receiving ART or antiretroviral therapy. As the HIV infection multiplies and destroys the immune cells, the patient develops a symptomatic HIV infection, and then the infection can include the symptoms of fever, fatigue, swollen lymph nodes, often one of the first signs of HIV infection, diarrhea, weight loss, oral yeast infection, which is thrush, shingles, herpes zoster, and pneumonia. Then if HIV is left untreated, it can develop into AIDS within 8 to 10 years. This stage is typically when your immune system is extremely damaged and can include the symptoms of sweats, chills, recurring fever, chronic diarrhea, swollen lymph glands, persistent white spots or unusual lesions on your tongue or in your mouth, persistent unexplained fatigue, weakness, weight loss, and skin rashes or bumps. So the earlier diagnosed, the better the outcome for the patient infected with HIV. How has this disease been treated by the medical community? Unfortunately, there's no cure to HIV/AIDS, but treatment is still available for a patient or person infected with the virus, and it can only treat the symptoms of the virus. What treatments have doctors prescribed? One treatment is TASP, and it can be used as a preventative measure. Another treatment is PrEP, which is pre-exposure prophylaxis, and it is for people who don't already have HIV but are at very high risk of getting it, and it is a daily medicine that can reduce this risk. And PrEP, which is post-exposure prophylaxis, is for people that have already been exposed to HIV or possibly been exposed, and it is only used for emergency situations. And it is most effective if it is taken within the first 72 hours of exposure, and it will greatly reduce the risk of contracting the virus. And then the last one, the treatment that can dramatically slow down the progress of the disease is the ART, or antiretroviral therapy, and the infected person must be strictly adherent to the treatment. The first treatment for this virus was discovered in 1998, and it is an earlier version of ART, and they have made more discoveries about the different preventative measures and treatments ever since that discovery. Other ways you can prevent or reduce the risk of spreading HIV is getting tested for HIV, choosing less risky sexual behaviors, getting tested and treated for STDs, not injecting drugs, and just being aware of your surroundings and asking those screening questions. How has this disease been understood or viewed within society? HIV/AIDS has been understood and viewed as a terrifying, detrimental disease within society. It has devastated many families, individuals, and communities. When HIV/AIDS was first discovered, the gay community received a lot more hate and discrimination than they were already receiving. When it was known that it could be transmitted to anyone, it was a scary time for everyone. People that were infected with HIVs were not able to work at jobs, but now, with the proper evolution of proper care and treatment for the disease, many people with HIV/AIDS lead normal, healthy lives, and most people with HIV/AIDS can continue working at their jobs or look for a desired job in a certain field. Well, this is my work cited, and thank you so much, guys, for listening to my final project, and I hope you have a great night. Thank you.